So, we're going to talk about Chapter 3 and understanding children's behaviors, which is going to be essential for understanding how to change behaviors or get the preferred behavior from a child. So, these are the objectives for the chapter. Basically, when we're done, you should have a good idea of what is expected or what is typical in each age as far as behaviors go. So, typical ages and stages. So, children are individuals. They develop in different ways, at different rates, and different patterns. And and that's okay, but we just have to make sure that we're diligent of that. Um, and when we're thinking about parents, they do find this comfort in knowing that many children at a certain age behave the same way as their child, so that they don't think that there's anything wrong. And the value of assessing each child is to match a guidance strategy to that individual child. Every child is going to be different, so you're going to need to adjust and create what works for them. So infants to 12. So a lot of time during this stage, got parents or guardians are feeling prideful, protectiveness, jealousy, fatigue, fear, all of these things. So in addition, caregivers are involved in care, right? Families may be relieved of some stress. However, then they worry about anyone else taking care of their infant. Infants don't do infants intentionally respond by crying? The first kind of upsetting behavior parents most cope with when caring for infants is this crying. The temptation is the tendency to project internal motives on a baby crying. Infants simply react spontaneously and unconsciously to their environment. So don't hesitate to give comfort and attention to babies. Some use the like let them cry it out, or you don't want to spoil them, and that's just not something that is proven through research. So you can't comfort or cuddle a baby too much. Do babies misbehave on purpose? The first months of life, infants have no capacity for consciously or intentionally selecting behaviors. Until they have object permanency, infants cannot think or know that any action will bring about a desired result. They can react or respond only in a very unconscious way, this internal feeling, such as pain or hunger, um, or an internal stimulation. Even in toddlerhood, some behaviors that may seem intentional are actually unconscious reactions. Children don't typically wake up in the morning and say, well, what can I do to ruin so and so's day today? That's really not the intention of a child, even though it sometimes, I guess, can feel that way. Unrelated objects, events, and sensations become connected. In newborns, almost all actions are simply reflex, and they begin to recognize and associate things they see, feel, hear, and taste as meaningful sensations or events. So, in this process, is called unconscious conditioning. Research has been documented on classical conditioning, so pairing a stimulus with a mutual occurring stimulus response in newborns. Usually, what is documented is a rather rough kind of learning called, we're not going to, called, usually, what is documented is rather difficult because so many newborns' movements can really be called voluntary. So, research tells us that from birth, classical conditioning is part of the child's day to day learning. Operant conditioning is when it occurs when a child's own voluntary actions are reinforced by a positive stimuli. So, in operant conditioning, the focus is on positively reinforcing very specific behaviors. Behaviors learned through operant conditioning continue as long as they're getting this positive or negative reinforcement. Metacognition is during this first year of an infant's life, they may need repetitions to form associations. When a child has developed metacognition, they will be able to think about their own thinking processes. Children between 3 and 6 um, only begin to develop this metacognition. School age children have a much better developed um, concept of this and this ability to plan and strategize. Muscle development proceeds from head to toe and from the trunk to the extremities. At first, infants are only able to control a, a few things. So their mouth, their eyes, neck muscles, tiny muscles in their hands and fingers will not be fully developed for years. So why do babies cry? If a baby cries, that behavior stems from internal discomfort, stress, or fatigue. Babies cannot be held responsible or blamed for their behavior. Infants become mm, habituated to patterns and objects when routines are broken. So, stress should be considered in dealing with children of any age and avoid or ease this stress whenever possible. Babies are born ready to pay attention to language. Don't be afraid to talk to your baby um, because these interactions can create this foundation for language development. And long before a child understands language, the child reacts to cues such as body language, um, the tone of your voice, and the volume of your voice. Constant exposure to stressful environments can dramatically change the way an infant's brain develops. This exposure makes a child more prone to emotional disturbances and less able to learn. Children exposed to severe prolonged stress may develop learning disabilities and emotional and behavioral problems. These children may become more valuable um, more vulnerable to medical problems such as asthma, immune system dysfunction, and heart disease. Basic care patterns offer the first opportunity to demonstrate a trustworthiness to an infant. This trust is the predictability and responsiveness of their primary caregiver. Appropriate touch has a powerful calming bond that can affect babies and young children. What the baby needs to know is authentic physical contact. So, holding, caring, playing, hugging, and rocking. Learned helplessness. Babies caught in events that are unpredictable and outside of their control may develop a style of response termed learned helplessness. Helplessness. Babies learned that there was no use in crying because it had no influence on the environment. It had no incentive to function in any way other than to be passive in their environment. The fundamental needs of an infant for care that will foster social, emotional, intellectual, and physical growth must take priority. Parent sleep question. Human babies must wake and feed regularly during the night throughout the first year. If parents or guardians choose to have a young infant sleep in their bed, they must be sure to follow sleep guidelines. Studies show no evidence of negative long-term problems from bed sharing if parents or guardians are comfortable with that arrangement. So, the external environment is important because infants shape future expectations through day-to-day experiences. An infant's internal sensations are important for adult responses because sensations and urges stimulate a child's innate behavior. Okay. So, balancing these two needs makes sense, right? But each teacher will develop and apply a personal educational philosophy. A caregiver can be very responsive to and respectful of cues while gradually nudging the child towards a routine. Interaction styles. So we're talking about authoritarian. So this style is a baby would be forced to eat passively and not touch the food at all. Permissive style is where adults they would shrug and accept the belief that the child's are hopelessness. Um, and then authoritarian style or authoritative style is where adults set reasonable but challenging expectations for their child based on their needs, interests, and abilities. So this is like the most extreme. This one is the calm one, and then this permissive one is basically that they're just like they're basic. You're not pushing them and you're allowing them to kind of dictate. Secure attachment to caregivers. So we talked a little bit about this in the first couple chapters. So just a basic review of this is it's when a baby and a caregiver create this bond, right? Research has shown that um, mothers were not the only people that could develop important emotional relationships with their child. And the term caregiver came into use to indicate awareness that babies could develop multiple loving attachments. So, why babies cling? Attachment must be recognized by caregivers as a valuable part of baby's early development. Developing secure attachment is an essential step in growth. Positive child guidance concepts of gentle nudging fits well with this type of attachment. And caregivers can support attachment and closeness while nudging the child to explore the environment. So these separation and stranger anxiety, so stranger danger. Attachment to caregivers serves as a survival mechanism for species. Sometimes between 6 months and a year, separation and stranger danger begins to appear in many children. The more positive experiences children have meeting new people, the less uncomfortable they will be with this separation from their parent. Pushing the baby into frightening situation is not helpful, but avoiding encounters with strangers altogether is also counterproductive. So, perceptions. In the first month of life, babies have not yet gained a mental conception of themselves as separate individuals. They make no distinction between their own physical being and the surroundings. Um, Babies identify so closely with their caregivers, the baby will automatically mimic behaviors of the adult. And caregivers who respond harshly or negatively reinforce inappropriate behaviors in babies by modeling rough interactions. So, this is when we're talking about if we don't want our child to hit, we don't hit them, right? We're modeling that behavior. So, when we come back, we're going to discuss toddlers' feelings and actions. We're going to go into toddlers now that we've finalized infants.